like to.
Frank, thank you. I think I found a place for the social engagement. For those people exercising and eating all day, they need to be with friends and sharing meals and that kind of thing. This has been an extremely enjoyable workshop. I really learned a lot from everyone and thank the organizers for putting together such a diverse group of researchers and practitioners to help us think through a lot of these issues. We talked, I just, as a gerontologist, just kind of want to bring up some of what we're talking about the last few days are aging process markers, and these are the fundamental biological processes of aging. And researchers in this area like to think about, is it aging or is it disease? And they can have very extended conversations around these things and you know, really getting at why are we all here? How and why do we age? And that's a very important conversation, very exciting. If you're interested in this, there was a wonderful series of articles in the, I believe it was the December issue of Science that talked through a lot of that. And a lot of what we focused on here is the biomarkers of what I like to call practical significance to people, to programs, and to payers, and thinking about all of this from a lifespan approach. So two of those markers that really rose immediately to the forefront would be physical function, living independently. And we have surprisingly simple measures to get at this, walking speed, strength, as far, and you know, how do we influence that? That's largely physical activity, but we're certainly learning more about how nutrition fits in there as well. Living independently, again, we didn't talk a lot about this. Samin brought this up for us, is social engagement. You know, living independently sounds great until you're sitting there all by yourself, but it also involves, you know, how to remain socially engaged. Inflammatory markers are a way that we don't really know. If you're looking at an individual, you don't know why their inflammatory markers are high, but you know something's wrong. So that's a very integrative measure that cuts across so many of the different domains. We also talked a lot about organ function and disease processes, and we have many roles. Some are established, some are emerging for food, nutrition, and exercise. Through our organ systems, our mental health, our cognition, and our other senses. Again, here we see how important physical capability is, musculoskeletal health, frailty. We had several excellent discussions around that, and our endocrine and immune function. Something we didn't talk a lot about, and I just want to bring it up again, is these costly biomarkers. If we want to have that conversation and be a part and influencing the healthcare system, the medical community, we have to think about how to speak their language. I learned this in my first van ride with the director of the Northeast Georgia Area Agency on Aging. This was back in the late 1990s. I was all on fire about vitamin D and B12, and that was how I was going to go in to these senior centers and talk to the you know, the administration, that this is what we needed to fix. And they're like, well, what would we care about that for? I said, well, you know, a lot of people are deficient in those. It was an easier sell around vitamin D because I could link that more closely with bone health problems. I was a little on thin ice on B12 because it takes a considerable deficiency to see the outcomes you get there. But I said, well, you know, I tried to explain about, there's some work that came out on gait speed and all that. Oh, gait speed. She's like, now you're talking my language. So once I could speak in the language of the people that make a difference in people's day-to-day lives, be the aging service providers or in the medical community, that's where we're going to make a difference. And Eve, you reminded us, I don't know where Eve went, of the, reminded us of the social ecological model. And when I think just telling people what to eat's not working, it's because we're not working through that model. And you know, where does the healthcare system come in, and how can we be partners and be influential there? So that's improving our care transitions, figuring out how to get our nutrition services into part of the package that people get so they are not readmitted to hospitals so fast. And then meeting what hospitals are really engaged about in the medical community right now is how our ACOs can implement and meet these quality care measures, because if they don't, it's very costly. And there's obvious places that we can both speak our same language around issues of mental health, depression, diabetes control, blood pressure, heart failure, and the CVD measures. Those are some of the things that really rise to the top.
Okay, thank you very much.